Hello, military friends and families. This is From the Frontlines. Today I want to talk about something practical, not emotional, not abstract, practical. Why veterans leave benefits on the table. The VA reported that in fiscal year 2023, there were over 1 million pending disability claims in the system at one point. That backlog number made national news. Even though the VA has worked to reduce it, the perception stuck. For many veterans, the message became simple. I do not deserve to apply, or it is not worth my time, because it will take too long. And when something feels overwhelming before you even start, a lot of people don't start at all. According to the U.S. Census Bureau, there are a little over 16 million veterans in the United States today. In New York State alone, the most recent census estimates show over 500,000 veterans living here. That number doesn't calculate the service members that were dishonorably discharged or state activated while in the Guard and Reserve. What are some of the challenges, barriers, and obstacles? Not every veteran that applies can be enrolled in VA healthcare. Not every eligible veteran files for disability, and not every eligible veteran receives benefits. Not every family uses education or housing benefits that were earned. Some of it becomes paperwork fatigue. The Government Accountability Office has repeatedly documented how complex VA claims processing can be. Forms, documentation, service records, medical evidence, exams, appeals. For someone already juggling work, family, and health, that process can feel like a second job. Some of it is denial fatigue. VA data shows that a significant percentage of first-time disability claims are denied or only partially granted. When that happens, veterans have the right to appeal, but appeals take time, months, sometimes longer. After the first denial, many people walk away. And then there's mindset. I cannot tell you how many times I've heard someone say, I don't want to take from someone who needs it more. Or, my injuries aren't that bad. Or, I signed up for it. But here's the fact. VA disability compensation, education benefits like the GI Bill, and VA healthcare are not charity programs. They are statutory entitlements authorized by Congress. They exist because service has long-term impact. Full stop. Another factor is Guard and Reserve confusion. Eligibility for benefits depends on type of service. Title 10 versus Title 32 activation, length of active duty time, discharge status, and specific qualifying events. That complexity leaves a lot of Guard and Reserve members unsure about what they actually qualify for. And when you're unsure, you delay. When you delay long enough, you stop. There's also mistrust. A 2022 Pew Research Center survey found that public trust in federal institutions overall has declined significantly over the past decade. Veterans are not immune to that sentiment. If you already believe the system won't work for you, you're less likely to engage with it. So what happens? Benefits sit unused. Healthcare goes unaccessed. Education benefits expire. Families miss out on resources that were designed to stabilize their future. And here's the part that matters most. When veterans leave benefits on the table, it's not because they're lazy. It's usually because they're tired. Tired of explaining their service. Tired of gathering documents. Tired of feeling like they have to prove something over and over again. This isn't about blaming veterans. It's about acknowledging the friction in the system. Advocacy is not just about increasing funding. It's about making sure the benefits already authorized are actually accessible. It's about clear information. It's about trusted local veteran service officers. It's about peer networks that say, let me walk you through it. Because here's the truth. You earn the benefits tied to your service. Whether that's healthcare, disability compensation, education, housing support, or family benefits. They were written into law because service has consequences, sometimes visible, sometimes not. If you stepped away from the process because it felt exhausting, that makes sense. But exhaustion should not be the reason something you earn goes unused. From the Frontlines is about making sure veterans and families know that access matters, and walking away from the system shouldn't be the default. If you need help understanding what you qualify for, start local. Connect with a county veteran service officer. Ask questions. Don't assume. This is From the Frontlines. Visit our website to learn more about resources and services that are free and accessible to you and your family. Thank you, and don't forget to take care of yourself.